Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been performing cosmetic or aesthetic plastic surgery in the Scottsdale Paradise Valley area since 1992. And all I perform is cosmetic or aesthetic plastic surgery. One of my favorite procedures is a facelift. And if you look at my website, you can see many, many before and afters. If you look at patient reviews, you can see how happy my patients are. And I think that is because I do it all the time, and I think I've been born with a really great aesthetic eye. I explain at length, as my office staff does, about the risks and complications that are possible with a facelift. My revision rate on facelifts is very, very low, but one of the real important things to do to understand with regards to risks and complications is what is the major risk of a facelift? Well, it would be a blood clot or a hematoma, but in terms of preventative things that you can do, one of the most important things that can cause problems with a facelift is smoking. So a question is, how does smoking affect a facelift and the result? And the answer is in every way. So smoking, how smoking works in a detrimental fashion is that smoking causes vasoconstriction. It causes the hemoglobin, which delivers oxygen to the bloodstream, to be not as efficient. So not as much oxygen is delivered to tissues to heal. And we all need blood and we all need oxygen for the tissues to heal well. Now, when I perform a facelift, I want your scars to be imperceptible. That is why I think that I perform so many facelifts. I always have patients try to stop smoking or stop smoking 3 weeks before surgery and 3 weeks after surgery. Also, patients that have been smokers in the recent past or have a heavy history of smoking, I make them perform hyperbaric oxygen treatments. And what that does is it helps enable the hemoglobin in the blood to become more efficient to deliver oxygen to the tissues. So that will help mitigate or decrease the risk of smoking. But overall, smoking is one of the big two that causes huge complications in facelift surgery. Complications with increased wound healing. You could have scarring both in front and back of the ear, and nobody wants that. You know, my patients, they're my calling card, so I want them to get beautiful, absolutely great results after surgery. So smoking is one of the primary risk factors for facelift surgery. It decreases blood delivery, it decreases blood oxygen delivery, and causes problems with scarring and wound healing. So that is how smoking is detrimental. I like to have my patients stop smoking at least 2 to 3 weeks before surgery, 2 to 3 weeks after, and if I'm concerned, I will have them do hyperbaric oxygen. But the best way to undergo this in terms of understanding what risks and complications are, come in and talk to me. I perform many, many facelifts, and I have very, very low complication rates. So communication is key. Come in and talk, and we'll talk about what your options are. Thank you.